Hello, thank you for joining me today to talk about everybody's favorite subject, Medicare fraud. So as Yvette mentioned, I am with the Pikes Peak Area Agency on Aging, which is through the Pikes Peak Area Council of Governments. The mission of the Area Agency on Aging is to work with our partner governments in our 3-county region, Park, El Paso, and Teller, to look at creating systems and programs that allow people to stay in their homes in the community for as long as possible. I, as part of that agency, am the coordinator for the SHIP program, or the State Health Insurance Assistance Program. This is a federally funded program that's designed to provide advocacy, education, and assistance on all things Medicare. So we are federally and state funded, and we are basically consumer advocates that are here to educate and assist people in understanding Medicare and any benefits that could be associated with Medicare in any way. So we're consumer advocates. We don't charge for our services. We don't sell any insurance. We don't endorse any specific companies or products. As the coordinator of that program, I cover a total of 9 counties in Colorado out of the Colorado Springs office. Every county in every state has access to a SHIP counselor or a SHIP program to get help with their Medicare. Most states you can access it through a toll-free statewide number. I've provided both the local and our state number here in Colorado for that program. A sister program to the SHIP is the SMP, Senior Medicare Patrol, which is what we're doing here today, which is a similar program. It's an advocacy program that's designed to provide education and information on how to prevent, or how to detect, prevent, and report Medicare and Medicaid fraud and abuse. And that's what we're going to be talking about today. So, again, the mission of the SMP program, or the Senior Medicare Patrol program, is to help beneficiaries detect, prevent, and report Medicare fraud and abuse. It's to preserve the integrity of the Medicare program itself, but it does rely solely on volunteers to do that work. This is, again, government-funded program. We don't get a lot of money to do this, but it is something that we are pretty passionate about doing. So I'm going to plug it now, and I may plug it multiple times throughout the presentation. We are always looking for volunteers who would be interested in helping us with this mission. So again, the mission of this program is to educate the public. This is a program that's through the Administration for Community Living in association with the Centers for Medicare and Medicaid Services, or Medicare. We provide or we conduct outreach and education. We do volunteer engagement, and we handle beneficiary complaints when someone thinks they may have encountered fraud or abuse with their Medicare or Medicaid benefits. You're always welcome to call us, and we will help you figure out what's going on with that, whether it's something that needs to be reported to a higher level of government, or whether or not it's simply a billing error on the doctor's office side or something like that. But that's what we're here for. We help you figure out those kinds of things. So, what is Medicare fraud? Medicare fraud is basically intentionally billing Medicare for services that were either not received or not necessary. But it's an intentional act. Abuse is when a provider is, say you originally had a prescription for a knee brace, and you found a provider, you ordered that brace, you received it, but then the next month you get another one, and the next month you get another one. That provider is abusing the system by intentionally billing Medicare multiple times for the same item that's not necessary to make more money. And then there are errors, which fortunately most situations fall under, whether it's a billing error because the provider's billing department coded something wrong, or they couldn't read the doctor's handwriting when they got the prescription and they just put in the wrong information, whatever. Errors are not intentional. They are simply that, they're errors, they're mistakes that can be corrected. And typically, if you have a situation where, say, Medicare denied paying for a service and it says that this was not medically necessary when the doctor told you it was, that's usually going to be a billing error, and those are correctable. Simply contact the provider, ask them to look at it again and resubmit it. Those are usually easily fixed. Take a little bit of time because they have to go through the whole process of resubmitting it to Medicare, but it's fixable. And again, fortunately, most situations fall under errors that can be fixed.
So Medicare will pay if they charge you for something
So the thing with Medicare is if you have a medical need and your doctor says you need to do this, that has established medical necessity. Medicare will always pay for any services that they cover that are medically necessary, no questions asked. But it's the doctor who has to tell Medicare it's necessary, based on however he writes up the order or what have you. Again, if something is denied that you clearly thought would be covered because the doctor said you needed to do it, it's usually because it was billed incorrectly. And you can contact the doctor's office and work with them to figure out what went wrong, whether it was, miscoded, typo, who knows. But it's usually something that if you communicate with the provider and see what you need to do to fix it, it can be fixed. Worst case scenario, you can always appeal a denial. Medicare always provides you the opportunity to appeal any denial of service through a very simple process. And if the doctor's office doesn't want to cooperate with you and look at the claim again or resubmit it for you, then you can always appeal it to Medicare and submit it with your own documentation of why it should be paid for. We are always happy to help with that process and to help you figure out if that's what needs to happen. So some examples of fraud and abuse: billing for services or products that were not ordered or necessary, billing for more products than necessary, obtaining someone's Medicare number in exchange for something else. That's clearly not going to be good. Improper coding. So say you go for a regular office visit with your primary doctor, but that doctor bills it as a specialist visit, so he gets paid more. That's not a good thing. Unneeded lab tests or unnecessary lab tests. So if your doctor sent you to go get blood work and you get a bill because they did 10 tests when you should have only gotten 2 tests, there's a problem there. Claims for services that weren't necessary, or using, of course, someone else's Medicare number to get services paid for. So consequences. There are huge consequences for any active fraud and abuse that goes on in this country regarding your Medicare. Identity theft obviously is going to be an issue. It can impact your health record. If someone is using your identification to receive healthcare services, that goes on your medical record. And that could result in misdiagnosis in the future, in an emergency room situation or something like that. So it can have a huge impact on you. And then, of course, financial loss. Billions of dollars every year are spent on fraudulent claims by Medicare. Not only does that cost us as taxpayers, but it puts the Medicare trust fund in jeopardy. Because if they're spending money on things they shouldn't be, that means there's less money to spend on things that should be spent on. Could result in higher premiums. If you're already enrolled in Medicare, you know what the monthly premium for Part B is right now. It goes up every year. It's gone up in smaller increments lately, but there have been years where it jumps up $10, $15 a month. Also, less money to add new benefits to Medicare. There are some things that Medicare doesn't pay for that we'd all love Medicare to pay for. Dental, vision, those kinds of things. Fraud impacts our ability to have that money available to convince the government to add those benefits. And it also creates a situation where it's going to limit how much doctors get paid or reimbursed. And when doctors are not happy with what they're getting paid, they're less likely to want to take Medicare patients. So it could impact your health and quality of treatment. And unfortunately, there are lots of different kinds of scams out there when it comes to your Medicare. The whole point of a scam is to steal your information or identification so that someone else can use it to make money, basically. That's the bottom line of any fraud, is to make money as quickly and as easily as possible in any way that they can do it. So I did have a short YouTube video, but I don't know that you guys would be able to hear it. We'll see what happens. I don't think anything will happen. Yeah. Nope. All right. So let's talk quickly about the most common types of fraud that you could encounter when it comes to your Medicare. We're going to talk about telephone scams, email and text scams, and the different kinds of methods that the scammers use to try and get your information. So when it comes to telephone scams, one of the most common scenarios these days is called spoofing, where these days everybody has caller ID of some sort. If your phone rings and it says you're getting a call from Social Security, it may not be Social Security. They have found a way to make phone calls look like it's coming from a legitimate source when it's not. So it's going to try and impersonate a legitimate business or entity, and it's going to try and get you to tell them something that you shouldn't tell them. Your Medicare number, your Social Security number, something like that. And these scammers are getting pretty good and pretty convincing in some cases. Emails, websites, text messages. There are phishing scams where if you get a text message from, say, an entity that you've purchased items online from, or you get an email from a company you've done business with in the past. It looks like it's from that company, but it may not be. And there are ways you can detect whether an email is legitimate. It's harder when it comes to text messages. And when it comes to text messages, it's always better to be safe than sorry. But these are the kinds of scams that are designed to get you to click on something so that you are taken to another website or something like that, so that that website can potentially install some sort of virus or computer worm or something dangerous into your system, into your device, so it can gather your information. And what it's looking for, again, is going to be your Medicare number, your Social Security number. It could be looking for bank account numbers. It could be looking for passwords. These days, it's kind of scary what these scammers can get with these computer programs. So a lot of times it's going to look legitimate, but it's not going to be legitimate. And there are ways that we're going to talk about that you can tell. So, ways to identify websites that may not be legitimate. First of all, most all legitimate websites will start with the https://. That means it's a secure website, and most legitimate entities are going to use that for their web address. If you are going to a site or taken to a site that does not include that in the web address, in the address bar, it's time to be a little suspicious. If you go to a website and whatever wording is on that website includes grammatical errors or typos, probably not going to be a legitimate site. If the graphics are low quality, that's usually a nice indicator that it's not going to be legitimate, because any legitimate company is going to put real effort into making a legitimate site so that they can do business. Those are just common sense things. So when it comes to text messages, I know I get them. Everybody I know gets them. Where it says, we tried to deliver a package to your house today and couldn't confirm your address. Please click here to confirm your address. Everybody's gotten that. Don't do it. Because that is exactly what they want you to do, is to click on that so that their computer or their program can get access to your device. So I know I've clicked on it in the past. Luckily, I quickly realized that I shouldn't have. And everybody's going to do it, especially the first time if it looks legit. But just always buyer beware. If you're not expecting a package, then you should be suspicious of text messages like that. If you're not sure, if maybe you are expecting a package, instead of clicking on something or tapping that link, call the company you were expecting something from. Just call the provider directly or the business directly to make sure. And most of the time they're going to say, we have no idea what you're talking about. And then block them. That is the most important thing, because if you don't block that text message right away and delete it, they're going to keep coming. And the more you let them keep coming, the more likely you're going to get more, because then your willingness to let those continue to be come to your device, the more entities that are going to find your willingness and send you more. So it kind of snowballs. So always, when you identify a text like that, block it and delete it. And most cell phones these days have a real quick one-touch button to do that. Emails, same kind of thing. I get tons and tons of emails sent to my spam because I pay a little bit extra so that they get sent to spam. But there's always something that's going to come through to my regular email box. I do a lot of searching on the web for work, if nothing else. So I go to websites that I can't even remember. So I have to be extra careful because I'm getting emails from everything. But there are ways to tell whether or not an email is going to be legitimate or a scam if it hasn't been directed to your junk folder or spam mail. Typically, the address is going to be the quickest and easiest thing to identify. So an address can look similar to, say, a business, someone you've done business with before, or a website that you go to on a regular basis, but there's always going to be an indicator in that address somehow, some way, that's going to tell you whether or not it's legitimate. Generic greetings are a really good indicator. If I'm getting an email from my credit card company, it's going to have my name in that email, my full name. If I'm getting an email from my credit card company and it says, "Dear customer," "Dear participant," something like that, probably not going to be legitimate. And again, grammatical errors, typos. Real professional businesses are not going to have grammatical errors and typos in their communications. So I was able to screenshot some samples. One of the easiest ways that I found to identify fraudulent emails is to take your cursor and just set it on top of the email address. When you set it on top of the email address, eventually a little box will pop up and it's going to show you the actual address that email is coming from. Clearly, in that box is not going to be an address you recognize. So that is the quickest and easiest way to identify a non-legitimate email. Oops. Also, if you open that email, you may see what looks like a legitimate address, but there's going to be additional letters or characters or numbers tacked onto it. Or it's going to look legitimate, but somewhere in there, there's going to be something extra that a legitimate company wouldn't include. Also, when I opened this email, it had that really big "Get Now." They want you to click on that. If they make it sound urgent or important, or you need to do this immediately, that's probably not going to be legitimate. And that's all that was in this email was "Get Now," wanting me to click on it. This email said Medicare planning, but when I hovered over the address, the email was roleplayingtips.com. Clearly, that's not going to be a Medicare source. Click here. Very little text in the body of the email. It actually had my email address as the address to or greeting. Didn't have my name though, just had my email address. Had very little text, but then it said, click here. And that's all it has. Other ways to identify non-legitimate emails is you can look for unsubscribe buttons at the bottom of an email. Legitimate emails from legitimate companies are going to, and they're supposed to have an unsubscribe option in the body of their email, always. So that if you no longer want to get emails from them, you can unsubscribe. Most fraudulent emails are not going to have an unsubscribe option. And this is just a quick example of a legitimate email. There's no nonsense when I hover over the address, straight and to the point, I would click on that. So just some tips, some common sense, some easy to do, doesn't take much extra effort. If you're not sure, do some of those things, and it will certainly help you and help keep you from clicking on things that you shouldn't. Other red flags, again, I mentioned the unsubscribe button. Even if an email has an unsubscribe option or a text has an unsubscribe option, that doesn't always mean it's legitimate. Again, when in doubt, contact the entity or the company directly if you've done business with them before. Undisclosed recipient, which is supposed to imply privacy. If you've done business with a company, it's going to address you directly by name. So there are always some common schemes that are going around on a pretty regular basis, especially when it comes to your Medicare benefits. Anytime you get a solicitation, whether it's over the phone, through text, through email, and they want to offer you something for free. Medicare is honestly really good coverage, but rarely do you get anything for free. And that is simply because nothing is free. You paid taxes, you pay a premium for your Medicare. Even if you don't have to pay for a service, it still wasn't free. And Medicare will never imply anything is free. These are benefits you have earned. Anyone contacts you and claims you're entitled to a refund regarding your Medicare. That never happens. Medicare is never going to do that, Social Security is never going to do that. And very rarely, even if you are owed a refund by your doctor's office, very rarely are they going to volunteer that. And then saying you need to update your Medicare information. Social Security has your information. It is as up to date as it's going to get. Unless you need to contact them to do a change of address, your information is updated. Social Security is like the final word of current information. Anybody who needs to update your information, so say legitimately your doctor's office did call and say, we tried to bill Medicare, but your number didn't come back as legitimate. If they're giving you the number that they have and asking you if that's correct, that's one thing. But if they're calling you and saying, we need to verify your information, can you please give me your Medicare number? That's probably not legitimate. Anybody who contacts you to verify any information like that should have that information already and should voluntarily give you what they have so you can verify whether or not it's accurate, not the other way around. And you never have to replace your Medicare card. That's just not a thing unless you lose it. And still, nobody's going to call you about that. It's your responsibility to call them and say, I lost it, please send me another one. And because Medicare numbers are no longer your Social Security number, which is what they used to be prior to 2018, because they're no longer a Social Security number, if you have any slightest doubt that your number was lost or somebody stole your Medicare card or something like that, they'll simply assign you a new number because they can. Now it's random letters and numbers as your Medicare ID. They can just assign you a new one without having any worries. And that's more likely what they'll do. So, what can you do to protect yourself, to prevent these things from happening? And how do you report these things if you do feel that something fraudulent has occurred? Well, some simple tips, things that you should do. Treat your Medicare number like a credit card number. Don't just give it out to anybody. Only give it to those entities that legitimately need that information. Always be suspicious of phone calls that are asking for that information. Always, always, always ask questions. If you've gotten a call and they say they're from your doctor's office, but you just have this inkling of a doubt, ask them, can I get a callback number? What's your name? What doctor are you calling me about? The more questions you ask, if it's legitimate, they'll answer them. If it's not, you ask one question, they'll hang up on you. That's simple. Medicare, Social Security, they never call you. They don't have the time, the manpower, or the energy to proactively contact you unless you have already contacted them with a concern. And then they may call you back. But they're never going to, out of the blue, call you for anything. The expectation is that you will contact them if you have a question, a need, or a concern. So anybody who's calling you saying they are from Social Security or Medicare and you weren't expecting that call, it's not legitimate. Anytime you get a call like that, I always encourage people to ask one question. I'm in the middle of something right now, can I get a number to call you back? Most of the time they're going to hang up on you. But if you can get a number from them to call them back, write it down, report it. Medicare, the Federal Trade Commission, Administration for Community Living, none of those entities know that these things are happening unless someone reports it. They don't have the funding or the manpower to go out and look for these things. They have to depend on the public to actually contact them and say, hey, I have a problem. And if nobody does that, there is no problem, because they don't know that there's something that they need to address. And trust me, Medicare is very, very adamant about addressing these things. Anytime I report something up to the Division of Insurance, they send it immediately to our regional CMS office or Medicare office, and they address it quickly. They want to know. They want to pursue it. If nothing else, they want to document it. And if they get enough situations documented, then they can put a task force on it. And they will. They do. Again, always be cautious of anything being offered for free, and tell your friends, tell your neighbors. Don't be afraid to talk about it. Again, don't give out your information. Don't be afraid to ask for a callback number. Don't be afraid to hang up. If you just don't want to deal with it and you realize it's a telemarketer or a robocall, just hang up. Hang up. They're going to hang up on you. It's okay to hang up on them. It's better to do that than engage in a conversation with them in any way, shape, or form, because the whole point of that phone call is for them to get you to talk to them. And the longer they can get you on the phone, the more likely they're going to get something out of you. Don't engage with them. Just hang up. And report it. Again, you can report it even if you don't get a callback number or any information. If you can remember who they said they were when you picked up the phone and you simply report that, that is better than nothing. Because if enough people report that I got a call from so-and-so, even if they have no other information, then that's going to trigger Medicare to start looking into so-and-so.
Who do you report it to?
You can report it to Medicare directly, 1-800. You can report it through their chat in the Medicare.gov website. You can report it to your local S&P office. That's us. You can report it directly to the Federal Trade Commission. You can report it to the Division of Insurance up in Denver. So there's all kinds of places you can report that information. And I have those contacts at the end. So some easy tips to avoid your information being used fraudulently. When you have Medicare and you receive services, you go to the doctors for something, you get Medicare summary notices in the mail that shows what doctors you saw, when you saw them, what you saw them for, what they billed to Medicare, what Medicare paid, etc. At least once every 3 months. Look at those summary notices. Read them. Make sure that everything listed in them actually happened. If you find something listed on there that you don't recall ever having that service received, that might be a problem. Now, granted, there are some times where, say you had an emergency room visit and you get that summary notice and you see claims on there because someone looked at an x-ray. You have no idea who that doctor is, but it's a legitimate claim because they looked at your x-ray. And if 5 of them looked at your x-ray, each 5 of them get to bill Medicare for that look. So sometimes that's legitimate, sometimes it's not. I mean, I've had people who had hospital stays that they did not actually incur themselves on a Medicare summary notice. They never went to that hospital, they never even heard of that hospital, but it was on their summary notice. So that is one of the easiest ways to identify things that are being done with your information. If you have like a Medicare Advantage plan, instead of a summary notice from Medicare, you're going to get what's called an explanation of benefits. Same kind of thing though. It's going to list all the services that was billed to that insurance for a particular time frame. If you look through that, make sure you actually received those services, saw those doctors, and if something is amiss, then you pursue it. You can create an account on the Medicare.gov website, a personalized account. It's quick, it's simple, it's easy to do, but it is secure. It literally takes 5 minutes to create an account on Medicare. And by having that account, you can look at all your claims being submitted by your providers in real time, instead of waiting for 3 months for the paper claim to come in the mail. You can also store a list of your medications so that you don't have to type it in there every year during open enrollment when it comes time to look at those options. It actually has an electronic health records option that would be shareable with your doctors, multiple doctors, if you wanted to use it. So again, it's another option where you can look at your information, make sure there's nothing amiss. If you come across a situation where you think there's a problem, some simple steps you can do or take to address that is, if you see a claim that shouldn't be there, anytime, gather information, gather documentation, gather whatever proof you have that something did or did not happen, something was or was not received, whatever. Gather information, contact your local SMP. Again, that's us. Yes, ma'am.
I have a question. What if you had, when you were charged, medication that you never received from a doctor, that got paid for?
But it got paid for by Medicare, like in a hospital stay scenario?
Yeah.
So that would be something you'd want to address with the medical providers first and make sure that, if you were in a hospital situation, if you're positive that you never received that medication, but it's in your bill as your bundle, then you need to contact the providers that you saw in the hospital.
When you're treated for something that you don't even have, and they say they gave you that drug.
That's an issue. If you never actually received that drug, it was billed to Medicare. Again, your first line of defense is to contact the provider, ask for medical records, and see what the medical records show, because that's where all the nurses' notes and the doctor's notes are going to be. Go through that information. You can also contact the billing department and say, hey, I never received this drug. There's no reason I should have received this drug or would have received this drug. Why did you bill it to Medicare?
Let me ask you this, if the primary says that, were you ever on this kind of medication, ever had this medication? Was that documented that you had this certain type of illness? Then wouldn't they be responsible to give you that information? Or how?
Well, your primary doctor is not usually the doctor that sees you in a hospital setting, though.
No, I'm not talking about a hospital setting.
But just your primary doctor saw that in your medical record.
Yes, in the medical record.
So that's kind of a different animal. That's a situation where more likely somehow down the line, someone mistakenly put information in your record that they shouldn't have. That unfortunately is harder to correct because it requires the cooperation of your doctors. It will require the cooperation of whoever put that in your record to be willing to go into that record and remove it. Unfortunately, I've found that can be difficult to do. Doctors don't tend to like to change medical records once they put information in it. What tends to happen most often in those situations is that if your primary doctor is willing, they can notate your medical record and say, this is incorrect information. Don't know how it got there, please. And then you've got to hope that whoever doctor you see, reads your record thoroughly. At the very least, if you have the ability, you should mention it to any new doctor you see or any doctor that's not aware of that. Make sure that you mention that to them or to their nurse so that they can notate that if they see that information, it is not accurate. But it is unfortunately very hard to change a medical record or correct it. At best, you're going to get a notation.
I thought that was against your health rights.
Theoretically, it is.
Yeah.
In real life, I've had clients who've had that concern before, and I've tried to help them get something like that corrected. It's not a fun process. It's not an easy process, and we met with a lot of resistance from medical providers in fixing something like that. So regardless of what is right and moral and maybe even legal for them to do, in real life, it doesn't always happen that way. Again, it's all going to come down to how willing any of your providers are to help you with fixing that. And with liability issues these days, it could be difficult to get a doctor to be willing to admit that they did something wrong. And that's really, unfortunately, what it might come down to. So, but that does bring up another good point. Be aware of what's in your medical record. Nowadays, you go to a doctor's office, they give you a whole summary printout when you walk out the door. Look through that information, make sure it looks accurate. If you don't get those printouts, it might be worth the while to spend a couple of bucks to get a complete record of your medical history from the hospital or whatever provider you've seen the longest, or from all your providers, and compare those records to make sure they look accurate from any provider that you've seen. Because that can have, again, a huge impact. If there's incorrect information in your medical record, that could affect how doctors treat you in the future. If they're looking at an incorrect medical record in an emergency situation, that could have a significant impact on how you're treated in a medical emergency. So when you have the ability to be proactive on those kinds of things, especially when you've already found an issue, it's worth spending the couple of bucks that they might charge you to get those records. And these days, they're pretty fond of charging you for medical records. I mean, they might give you the first 10 pages for free, but then they're going to start charging you. So yeah, definitely if that's ever a concern, it's worth doing. Just so you know what's there and you know what they're looking at if something happens. All right. So again, report. Here's a list of some of the places that you can report that to. Division of Insurance, because this program is managed in Colorado through the Division of Insurance. They have a web page on the Division of Insurance website specifically for this program with a complaint button. There's the national website for this program and the Federal Trade Commission. They're happy to take any fraud complaints or concerns, always. That's their job. That's what they do. And then just a screenshot of the national website for this program. All of those websites have real easy complaint processes, and it's usually just want to file a complaint, click here, and it takes you to a form to fill out. Simple as that. All right, so that's about it. Again, this program is government funded, so we are never going to have enough money, and it is supported primarily by volunteers. We are always looking for volunteers. The training for this program is done locally by me. Again, I cover 9 counties in Colorado. Doing the fraud counseling and education is probably much funner than the Medicare counseling and education. It's a little less complicated, and it takes less time to learn. So if anybody is ever interested in the volunteer opportunity, please contact me. And my contact information is at the end. Again, this is my contact information through my organization, both our local Colorado Springs number and our statewide toll-free number. If you call the statewide toll-free number, it's going to route you to the SHIP program office closest to where you're calling from. So there are a total of 13 SHIP programs in Colorado, so that every county is covered by a counselor. And if you want more information about the SHIP program in general, you can go to the SHIP TA Center or shiphelp.org, and it will give you more information about this program in general. And that is all I have for you. There are lots of handouts about specific topics, fraud related, on the table in the back. So that's all I have for you. Does anybody have any questions? Yes, ma'am.
Does the SHIP program have additional requirements to help people with medical prescriptions and stuff?
Yes, so one of the biggest functions of the SHIP program is during open enrollment, or for when people are just becoming eligible for Medicare. So we absolutely can help you figure out prescription drug plans, Advantage plans, what all your other options for insurance are when you become eligible and enrolled in Medicare. So that you have all these other options that you can choose from to go with Medicare. We can absolutely help with all of that.
Is that initially for people that, what if you're already on?
Whether you're new to Medicare, just getting ready for Medicare, been on Medicare for 20 years. If you have a question, concern, or a need, you can call us. We also help people with screening and eligibility for financial assistance programs related to Medicare. We can help people apply for Medicaid programs. I can review long-term care policies. And if you call us and it's not something that we can help with specifically, we can direct you to whatever organization can help you. Because again, we're part of the Area Agency on Aging. I don't know if you guys are familiar with the Yellow Book, which is a resource directory that we print every year that provides resources in our 3-county region, for anything from employment to financial assistance to benefits to caregiving, you name it. If it's out there, it's in our resource directory that we print every year. So we can act as just an information resource as well. Any other questions for me?
How does Silver Key fit into that?
Silver Key?
Yeah.
So Silver Key is a wonderful organization. They do lots of different things. The difference between the Area Agency on Aging and Silver Key is we can provide information and assistance, but we don't usually provide any direct financial support. Like Silver Key does Meals on Wheels, they have transportation programs. Our organization funds them and gives them money to support those programs, but we don't provide those kinds of services directly ourselves. So we can provide information and counseling and stuff like that, but we are pass-through for the funding for other organizations like Silver Key so that they can provide direct assistance. Any other questions? Well, I really appreciate you guys coming today. Luckily you didn't. Well, thank you. I appreciate that. Thank you. And again, there is more information in the back. There is also a survey that if you're willing to take it, it's just a few questions. I would greatly appreciate it. Medicare does look at the survey results and logs that information as to how effective our programs are, and it does affect our funding. So anybody willing to take it, those surveys are on the back table as well.